Hello, I'm Dr. Mark Thompson, and I want to talk to you today about cold and flu. It's that season. It's about early part of January here, and it's in full swing. Normally, I don't think that the flu vaccinations are very helpful. I'm pretty dubious about them to begin with, but this year they picked the wrong strain, so I know it's not helping anybody. So I thought this would be an opportune time to talk to you about the three huge things that you should be doing so that you don't get the flu to begin with, or you get over it much faster. Okay? Number one, I'm a chiropractor, so what am I going to tell you? Get adjusted. You're right. All right, and there's a reason for that, because you want your brain to fully control and communicate with, orchestrate, if you will, this system of organs that is your immune system. So basically, your brain should be sending information down the nerves to the target organs like the liver, the spleen, the thymus gland, the Peyer's patches in your small intestine. It's like the lymph glands in your neck. It's amazing, and it's a huge part of your immunity. So you want the brain controlling all of those organs, and then you want those organs sending information, feedback information to the brain so it can make adjustments, right? Okay, if there's a breakdown anywhere along the way, and what causes that breakdown? Usually it's having a spinal joint or joints that's out of place, and it's interfering with the nerve transmission. So if your brain can't talk to the organs, or vice versa, the organs can't send the feedback up to the brain, there's going to be an issue. So come in. Everybody should be getting adjusted, okay? Whether it's weekly, bi-weekly, or monthly, depending on your situation, your stress level, how much you're sleeping, how are you eating, are you exercising? There's a lot of factors that go into it, but everybody should be getting adjusted on a regular basis. Okay, number two, in the last 10 years, the last decade, there's probably been 100 different studies on vitamin D and how it affects your immune system. It's a huge part. Basically, without it, you don't have an immune response. It's what turns it on, okay? So you need not only an adequate level, but you want to optimize it as much as you can. So come in and talk to me. I'll tell you how you can get that tested. But in the meantime, I just go ahead and do it. Through the cold and flu months, from fall to spring, basically, I do 5,000 to 10,000 international units of vitamin D per day. At the first sign of a cold or flu, I go up by a factor of 10. I'll take 50,000 international units for a couple of days to fully saturate my system, make sure my immune system has everything it needs to help fight this off, okay? So vitamin D, a huge factor in your entire immune response. So number three is, back in 1918, there was the Spanish flu that killed about 40 million people all around the world. And in the 20s, there was a doctor here from the US, his name was Simmons, and he was studying animals. He was trying to infect animals with the Spanish flu so he could study it. And whenever he'd introduce the virus into their eyes, their nose, or their mouth, it was like flipping a coin, whether or not they would actually contract the flu. And so whenever he introduced the virus into their ears, it was almost 100% of the time the animal got the flu. So fast forward about 10 years, the Germans pick up his original research, and they said, well, that makes sense. So what they did is that season, everybody that came into this particular hospital was divided into two groups. Either they, did the normal thing, I guess hydrate them, give them some sort of over-the-counter thing, I don't know. Anyway, but the second group they would treat with 2 to 3 drops of 3% peroxide in each ear. And what they found was, if they were treated within the first 24 hours of contracting the flu, they were over it in 48 hours, okay, with just treating it with hydrogen peroxide. It's that powerful, okay? So I highly recommend at the first sign of cold or flu, you treat both ears, okay? Whether you have pain in your ears or not. I'm not talking about an ear infection. I'm talking about a vector for the flu virus to get into your body and infect your body. So treat the ears. A great sign, actually, is if you spike a little bit of a fever within about an hour of treating the ears. You want to look for about a half a degree to a degree, maybe a degree and a half on the outside. Sometimes you just feel a little worse, then you'll nod off to sleep and you're just kind of achy and pretty low energy. That also, I interpret as a good sign. If that's the case, then I increase the frequency to 3 times a day, about every 4 hours, okay? So, and then assuming everything is going well, the next day I drop down to twice a day, and then the third day I drop down to once. I don't stop until I feel I'm completely over it. But treating the ears at the first sign of cold or flu is a huge factor in how quickly you can get over it. Again, the earlier in the flu process, the better your results, okay? The quicker you're gonna get over it. So for infants, it's a little different, or small children. Sometimes I use a grapefruit seed extract product. And ask me about that, because you don't want to use an undiluted grapefruit seed extract. It can blister their ears. It has to be diluted. And there's a couple of products on the market that you can get that are marketed for eardrops. So the 3 huge things that you should do to not get the flu or get over it much faster are: get adjusted, right? Optimize your vitamin D levels, and then treat your ears at the first sign. So thanks again for coming by. I'll see you soon.